The fourth Arts and Health Check-up Check-in took place at Garter Lane Arts Centre, Waterford in April 2019. The event was organised by Waterford Healing Arts Trust through artsandhealth.ie and Create, the National Development Agency for Collaborative Arts, with local partners Garter Lane Arts Centre and Waterford City and County Council Arts Office. Arts and Health Check-up Check-in is the arts and health community's annual networking event. It's a day for artists, healthcare professionals, arts and health coordinators and anyone interested in this area of work. It's a time to get together, away from desks, studios and healthcare settings, to have face-to-face conversations, to make connections and to talk about arts and health practice. The theme of Check-up Check-in 2019 was Promoting Autonomy. We explored how arts experiences in healthcare settings can provide ways for individuals to engage, discover and create even when faced with a challenging health condition. In his keynote address, Disruption, Danger and Discipline When the Artist Becomes Leader, Mountbatten Hospice CEO Nigel Hartley reflected on the role of the artist in end-of-life care.
I think the world needs more artists as leaders. I think the world would be a very different place if artists were actually in control of it. And I also think, certainly from my perspective, I'm not talking around the arts as being used in care or for care or through care. The arts, I think, are inherently caring themselves.
Arts and health practitioners shared their experiences, exchanged ideas and inspired each other through a range of themed presentations. Sticking points focused on the challenges artists and healthcare professionals have faced in their work and their solutions to overcome them.
So we negotiate the boundary every time.
Arts and Dementia featured presentations of projects where artists engage with patients through music and visual art. And the panel discussion, chaired by consultant geriatrician Dr. John Cook, explored ways to progress this work.
That I and others are trying to do is try and reorientate the health service so that we start to value outcomes that are important to patients rather than outcomes that are important to the system. And I would probably like to hear from the artists. I mean, if we're to try and build services, we have to acknowledge that we have to build into those outcomes because otherwise we can't get money for them.
What's My Practice was a series of workshops looking at a wide range of methodologies, including movement, music, theatre and visual art, employed in socially engaged arts and health practice in different settings.
Interview work with both consultants and both the medics of us, and because of our connection and because we do deep interviewing.
Composer Eric Sweeney and poet Edward Denniston reflected on their tenure as artists in residence at University Hospital Waterford in 2018 and the creation of a choral work, Hospital Voices, in collaboration with patients and staff to mark the 25th anniversary of Waterford Healing Arts Trust. This wonderful day of exchange and inspiration concluded with a closing conversation reflecting on some of the main themes which had emerged. Continuing the 25th anniversary celebrations that evening, Anne O'Connor, Head of Arts Participation at the Arts Council, launched an exhibition in Garter Lane Arts Centre entitled A Celebration of Waterford Healing Arts Trust in 25 Objects.
The artist department. And really it's the, I suppose, expertise and partnership of all of our visions that makes up the prism that is arts and health practice. And we may have...
Arts and Health Check-up Check-in 2019 was funded by the Arts Council, Waterford City and County Council and the HSE.
The arts are kind, they're generous and they call people in.
For further news and events, see artsandhealth.ie.